This is TTT. Live for local.
This is TTT Live. I'm DK Rosta. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Chalk City 91.1 FM, Sweet 100.1 FM, and on Facebook at TTT Live Online. We go now to the Minister of Communications, Donna Cox.
Good morning and welcome to today's virtual media conference to apprise you of government's efforts to combat COVID-19. Today with me are the Minister of Health, the Honorable Terence Dial Singh, the Chief Medical Officer, Dr. Roshan Parasram, and Dr. Joanne Paul, Head of Department, Pediatric Emergency at Eric Williams Medical Sciences Complex. The Minister of Health, the Honorable Terence Dial Singh, will provide an update on COVID-19 in Trinidad and Tobago.
Thank you very much, Minister Cox, and good morning to the Chief Medical Officer. Also, good morning to my colleague, Dr. Paul. Good morning to ladies and gentlemen of the media, wherever you are this morning, and all citizens, visitors listening to us wherever you are in the world. This morning, Saturday, 18th of July, Minister Cox, I would like to deal with 3 issues this morning, if you would allow me.
Definitely.
Issue number 1 has to do with the regulations which are currently in force. As the population may be aware, the current regulations expire on July the 19th, which is tomorrow. As part of government's continuing monitoring of the COVID situation, the following adjustment to the regulations will be in force from tomorrow. They are currently being drafted by the Honorable Attorney General, Chief Parliamentary Counsel, and everything that goes into that. And that is, having noted the surveillance of bars over the past few weeks, where we feel that now the time has come for bars to now revert to their 10 p.m. closing time. We are asking again, as we do this measure, that both patrons and bar owners use the opportunity to continue to play their part in operating and behaving and using these facilities responsibly. So let me just repeat, when the new regulations come out, effective July 20th, bars will revert to their 10 p.m. closing time. That is issue number 1. Issue number 2 has to deal with the 3 positive tests that we got yesterday with nationals who returned from Grenada. I was in conversation with my colleague, the Honorable Nicholas Steele, the Minister of Health of Grenada this morning, and we are both concerned with this development. I could tell you that this has led to Minister Steele having to institute a tracing activity for 127 persons with which who these are 3 Trinidadians may have been contact with in Grenada. These persons were in Grenada since March, and I would like to quote him, they were all over the place, so they weren't quarantined. And both he and I feel this should be another warning to us not to become complacent. These 3 nationals will be retested on Monday, and both he and I and the CMO, who has also been in touch with the CMO of Grenada, his counterpart, we are hoping that by Monday we can get a negative result, but right now we are treating them, because of the results, as positive cases. That's a very worrying development. The third issue, and it has to be taken in the context now of what happened as we continue to let bars reopen until 10, the 3 nationals who tested positive from Grenada. The third issue I would like to address frontally and not run from it is what happened yesterday, nomination day. mainly in Trinidad, not Tobago so much. Few incidents, again, should give us pause for concern that we need to observe basic protocols. Hopefully, collectively, I think all 39 seats in Trinidad and Tobago, regardless of political affiliation, all the parties, all the candidates, and especially the campaign managers, should ensure that what happened yesterday, where in some seats there were a breakdown in protocols, does not happen again. We know nomination day is a day of high emotion. There's mixing of the two major groups showing their love and respect for each other on nomination day. But in some areas, it was a bit concerning. Let's hope that that is an aberration. I would like to think so. And the same advice we have been giving, that if you have more than 25 persons in your entourage as your followers, separate them into groups, make sure they have on masks, make sure they are physically distanced as far as humanly possible, because we don't want community spread. So, Minister Cox, those were the three issues I wanted to address frontally. And let's hope, as I say, what happened yesterday is an aberration, it's a one-off, and we look forward to cooperation from all candidates, myself included, all political parties and all campaign managers moving forward. Thank you very much, Minister Cox.
Thank you very much. That is good news for bar patrons and owners, and we just ask that you continue to be responsible. The Chief Medical Officer, Dr. Roshan Parasram, will provide us with a clinical update.
Good morning, Honourable Ministers, members of the media, members of the viewing and listening public. The clinical update for Saturday, the 18th July 2020 is as follows. The total number of tests done thus far in the public sector, 6,001. Total number of unique patient tests, 4,538. Total number of repeated tests, 1,463. The total number of community tests done at the UV lab, which is in the public sector, 2,174. And at 10:37 a.m. this morning, I just received a WhatsApp message from the Director of Virology at the Caribbean Public Health Agency, who indicated that we have case 137, which is another imported case coming from a group that had recently been repatriated into Trinidad and Tobago. So we have now case 137, which is different from the 10 a.m. report, which says 136. So there's one addition since the 10 o'clock report. The total number of discharges remain at 124. Total number of deaths remain at 8. And now the total number of hospitalized patients are still at 4, including the 3 that we had from the Grenadian contingent. The one person that we just diagnosed will be taken to the Cora facility a little later on today. So in terms of the numbers of persons quarantined, as you know, we had approximately 54 persons coming in from Grenada on Wednesday and 70 individuals coming in from Canada on Friday, taking our total quarantine number up to 162. Within the Debe Penal UV campus, we have 48 persons. At the Cascadia Hotel, we have 44. At the Tacarigua facility, we have 21. At the Home of Football, 36. And at the Chancellor Hotel, we have 13. So 162, that number will go down to 1. And the number at Cora will go up by 1 a little later today when we do the transfer of that individual. Minister Cox, that's my clinical update for today.
Thank you very much, Dr. Parasram. Dr. Joanne Paul, Head of Department, Pediatric Emergency at Eric Williams Medical Sciences Complex, will provide an update on COVID-19 and children. Dr. Paul?
Thank you. Honorable Ministers, Chief Medical Officer, good day. Members of the media, ladies and gentlemen, thank you for inviting me here today just to discuss the updates with children. Now, as we see the data changing, it's evolving. So as of today, but I'm not sure what will be the new updates in the next month or so. As of today, just a few things to think about. Number one, I want us to think about the COVID virus itself, not so much as a respiratory virus, but as a virus that goes to receptors. So in adults, there are more receptors in the respiratory system, and that's why it's seen to present like that. But of course, there are other receptors areas. So for instance, there are other organs, the brain, the liver, the heart. So that's why you might present with other symptoms aside from respiratory. In children, though, the difference is that their receptors are spread all over. So therefore, they might not present with respiratory symptoms. They might have, in fact, it's equal in terms of respiratory, in terms of gut, in terms of brain, in terms of heart. So that's why they seem to be sort of like asymptomatic, but it's really because they might present with lots of different features. It's very non-specific because it spreads so many all over. So it might be headaches, vomiting, diarrhea, it might be cough and cold, it might be sort of like where your heart is beating faster or is beating slower. So they can be very non-specific. That's the first thing we have learned so far. The second thing is that they are not deemed to be super spreaders. So in the beginning, we weren't sure because typically children spread viruses much more than adults. But because they have less receptors in the respiratory system, that's the difference of it. Therefore, they are spreading less. So when they cough or when they do the normal things that will super spread, for instance, things like shouting, also things like singing, sneezing, they don't spread as much as adults. So in fact, the research done in Australia and Holland has shown that adult-to-adult transmission is pretty, whatever it is in terms of the rate. There's adult-to-child transmission, but in fact, child-to-adult is much less, and child-to-child is much less. Now, that does not mean that children don't spread. It means, though, that adults spread more than children, and children are not super spreaders. But caveating from that, though, what they have found is that the groups that are deemed super spreaders now are the adolescent and the young adults. So the ones who are going to, say, 12 to 18, and the ones who are 18 to 28, those groups are the main super spreaders. In fact, the key age for super spreading is age 21. And it's not because of receptors or any genetic circumstances. It's because those are the ones who are in bars, who are in large groups, who are having limes in different places and having large groups where they're touching and hang with each other. And they have found that that's the super spreaders. So based on that, we know that lots of parents, we know they had online learning, school learning, and now we have July, August. And of course, we want to do more with our children. We want to go out there. The thing is that based on the fact that those two groups are the super spreaders, you really want to restrict that. So the recommendation is no large sporting events. The recommendation is continue as is and stay at home with your child doing camping stuff. There are lots of creative stuff to do. So for instance, there's online camping with neighbors. I could actually be doing Monopoly, lots of games with your children. You can do a small goal, football at home. I can do camping at home. There is learning a language. And in fact, what they've found is that if you do very creative things with your children, that non-academic thing will increase their brain size even more to make them perform even better academically. So I would recommend that parents sit down and plan their camp for their children. It can be one night movie night. One night might be listening to different kind of music. You can plan different sporting events at home, kids with their cousins. We don't want, if we know that those two groups are the main super spreaders, the recommendation is not for us to go out and have any large fixed sporting events. The other thing to mention is that what they found is that there are three main things that make a main difference with regards to COVID and spread. So not the ICUs, not the doctors, not the medication, not the nurses. The main three things are wear a mask, wash hands, small groups or small up. Wear a mask, wash hands, small up. That has made the biggest difference so far with regards to COVID spread. The other things for us to think about with regards to children, so in the beginning we thought it was mild and they weren't as affected. What we've found now is there's something called MIS-C, and I know we've read about it. It's MISC, so it's multi-system inflammatory syndrome in children. So obviously it goes along with where the receptors are, because the receptors are all in various systems. It affects all the systems. So what they've found is that it's an immune response to the COVID virus. So we've had COVID, and those children now have a response, or over response to it, and it's all the systems. And what they present is not that common, but when they do present, it can affect all the systems. So therefore it might be headache, it might be again vomiting, diarrhea, abdominal pain. They typically present with rash, and the rash is where it might be on your sole, your hands and soles of feet might be red. There might be a rash there, but interestingly enough, at the fingertips and the toe tips, it's more like a clotting rash, where it's not, it looks like small clots here. That's a big sign of it. Also red eyes, red tongue, red lips. And so we're looking for that kind of thing. So the rash, headache, still respiratory, but the other signs we spoke about in terms of the gut signs, and also the heart beating fast or slow. Significantly, if they have that and they seem to be a bit like off color, or what we call in Trinidad cargo, and they seem very lethargic, they might be sort of like going into shock. And you really want, that's how it presents in terms of having those symptoms and being lethargic, and you might want to bring them straight to the hospital in that uncommon case. So it's called Miss C. It's pretty dramatic, but it's fairly uncommon. But what they found significantly is that it's 6 to 8 weeks after the peak of the adult COVID. So once we have our peak, once we look afterwards, because they have an immune response to it, then it happens. And the height of the peak of the adult COVID is comparable to the height of the Miss C peak. So therefore, to protect our children right now is to go into our routine. Be creative, be cautious, and we're trying to reduce the peak of the adult COVID, to reduce the peak of the Miss C itself. So we're looking at the three things. We're looking at wash hands, wear mask, small up. That will make the difference for us when we have our peak of COVID. So in terms of summary, just remember, children, they are found to have non-specific generalized symptoms and signs in terms of COVID. It's not like adults. They can present with any part of their system. They're still milder. They're not super spreaders, but the ones who are the adolescent and the young people are. And we're looking now at Miss C as the things in children which might be sent afterwards. Now, you might still get a few, but in terms of having the peak is going to be afterwards. And I know I'm repetitive about this, but the three main things, if you leave today with anything, and I know we have said it over every news conference, but if we can really get into that routine now, no matter what hits us afterwards, you'll be able to handle it. Wash hands, wear mask, small up. Thank you very much for your time.
Well, first of all, thank you for explaining a very complex matter that the layperson like myself and everybody else could understand. I want to thank you for that. My question to you is, could you explain to me more about this 6 to 8 week lag between the adult peak and the pediatric peak, and what accounts for it, please, so the population could understand where we are coming from?
It's very comparable to something called Kawasaki. And in Kawasaki, which is much more prevalent, it's very uncommon, but it has symptoms that the same rash on the fingers. And they found with Kawasaki, it's the same thing. It's an immune response to the virus. So they thought this virus was where it was attacking. It's really, when we look at how the virus responds in individuals, it's all about our immune response to it. So for children, after we have had the peak, it stays in your system, and the body itself responds to the virus, but then something trips, and then it over-responds. So it responds like about 10 times. And so all those receptors and all those organs, they have a cascade of over-response, and there is a delay. So it has to be where the kids are exposed, they become positive, they don't show many symptoms at all, they're very mild, or they might show non-specific symptoms, and then the virus settles down, stays there. So the virus is no longer there, but the immune response, the body is just responding extra, and it sort of takes a week, and then it just builds up, and then after about 10 times, it just goes to all the systems in the body. So it's fairly dangerous, but it's uncommon, luckily. And because all the pediatric staff in Trinidad, I must say, they've been having conferences about this, and they also have protocols about this. Once we know what's happening, we have a clear treatment plan. It's just for the population to be aware to look out for it. So just reiterating, they have the rash, especially on the tips. They may present with a combination. The common things are fever for 3 days, at least more than 3 days, rash, headache, abdominal signs. It might be maybe some diarrhea, but usually it's abdominal pain. And the main thing, they look lethargic and cargo and off color. So if you're worried about that with your child, especially with a rash, don't overthink it. Just say, you know what, let me go check because I don't want to miss this at all. So it's definitely 6 to 8 weeks afterwards. And again, this is evolving. So as we know more information, we'll be able to pinpoint more, but they have found that there's a clear demarcation peak afterwards. That's why the first case was found in England only in April. So they got hit with the virus, and then they had a peak 2 months afterwards, and then they started seeing cases, and in the US the same thing. So it's a strange phenomenon which we're trying to understand.
So one last question, because I think this is important.
Sure.
Both the CMO and myself have been getting literally hundreds of calls about why are we being so steadfast in not recommending children's activities like karate, football, contact sports, and so on. I have no problem if you speak truth to power this morning and disagree with us or with me. Do you think that these sports should be opened up now, or we should continue with the advice, hold off on these activities until September?
So
Please.
the fact is that I've been in the department, we've been reviewing the COVID information on a daily basis, trying to make sure we're updated. And they have been clear with what was the most significant thing. So there are 3 things, as I said, but out of those 3 things, they found the most significant thing are the group activities. Once you have group activities in terms of not small groups, but large groups, that aspect of having a cluster, an explosion of the virus itself is really high. So the thing is not about not having transmission. We aren't going to have that. The thing is to have extreme transmission in a speedy manner, because the whole point about this is a habit where we are exposed, people are getting sick. When it does come in and we have local spread, we are going to get sick. But the whole point is to not have it where the cases are coming up into a massive peak where the health system can't handle it. That's the whole point about this. So therefore, if we can have it where we're having transmission, where it's a sort of like a plateau transmission, is not peaking and skyrocketing, then we know we can handle it. And so to prevent that, the most important thing is to not have that large group activity. So although the adults themselves can transmit a little bit more than the child to child, but the young adults and the adolescent, those are the ones who have the receptors where the adults have it. They're the ones who will be laughing with each other, shouting, singing. I mean, most sports, as you know, is shouting. And so once they do that, so they're having direct contact, they're shouting, and then they might be just right in each other's faces. That is like an epicenter for us to have an explosion of cases, which is what we don't want. So I know, I mean, I've been there. I know it's been difficult, but the thing is that we want to make sure we follow what the team has been saying. It has worked, and let's continue as is. We have the whole rest of the year. It's a marathon session. We're in it. Let's do it together. And the thing to do is follow the advice. It's really 3 things: not to have those major activities, sporting activities. 3 things: wear a mask, wash hands, small up, and do be creative at home with your children. Thank you.
Thank you very much, Dr. Paul. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. We want to give as many of you an opportunity to pose questions to us, but that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. Once we have completed the poll and time allows, I will come back to you. So let us keep this in mind as we begin taking your question. I recognize TTT.
Good morning.
Morning.
Good morning.
In terms of the election period and campaigning walkabouts, we have seen in some cases where the gatherings have exceeded the stipulated 25 people. In the event that this continues, what is then the next step to ensure crowd control? And I guess by extension, my question also relates to bars, social distancing, and mask wearing. Now that they have had their hours extended, what is in place again to maintain crowd control, mask wearing? Thank you.
I will take part of it. As we have said from these news conferences, the advice given by myself and the Minister of National Security on Thursday, it is incumbent upon candidates, their campaign managers, and so on to ensure that if you have more than 25 persons campaigning with you, that they do the common sense things. That is, distribute masks, provide masks for your supporters, keep them in groups of 25, separate each group, but within each group there should be a certain degree of physical distancing. Those are the common sense measures. Also, each campaign should have an adequate supply of hand sanitizers so persons can sanitize their hands, and also water, because sometimes you may want to just rinse off your hand, wash your hand. And these very common sense measures can go a very long way to make sure we have a safe campaigning period. On the issue of bars, we ask the bars and the patrons to, again, it's difficult to wear a mask in a bar situation. So that is why we advise on the social distancing, but it will be up to the Trinidad and Tobago police force to enforce the measures as far as crowd control in bars and even campaigns are concerned. But there's a lot of collective responsibility on all of us now. We don't want to overburden the police service, so let's all be in this together and just apply the common sense public health measures we have been talking about for now about 5 months. CM, I don't know if you want to add anything.
I think we're okay.
Okay, thank you.
Okay, good. We move to 98.1.
To the panel, Stephen Cummings, 98.1 FM. Two questions, one for Dr. Paul and Minister Dayal Singh. You can probably take the other question. First, start with Dr. Paul. Dr. Paul, you weren't in on the last press conference, and I did pose this question, but I wanted to get, I need to get your perspective on this. A leading U.S. medical journal known as Proceedings of the National Academy of Sciences, in a study, found that silent transmission could be responsible for half of COVID-19 cases. Now, the model assumed that COVID-19 may be the most contagious during the pre-symptomatic state, which is uncommon for a respiratory infection. Now, simply the view is that pre-symptomatic COVID cases are a primary driver behind the virus spreading to others. I wanted to get your response or your perspective on that. And Minister Dayal Singh, on the last occasion, we were told about women and pregnancies in connection with COVID. Has there been any bit of information sharing or joint educational initiative between the Ministry of Health and the Family Planning Association as, we treat with and educate mothers-to-be and women in general about COVID? Thank you.
So I'll go with the second one and let CMO and Dr. Paul. So let's piggyback on what Dr. Paul has said. We at the ministry and in the RHAs, as she said, on the issue of pediatrics, they share information. It's a continuing program of information sharing. The Directorate of Women's Health, Dr. Adesh Singh, through our population control division, I would assume, I don't know for a fact, but this is routine information sharing that goes on across the health sector without the active intervention of the Minister of Health. So information sharing with stakeholders, regardless of whether it's maternal health, pediatric health, NCDs, goes on. And I will assume that Dr. Adesh Sirji Singh is in fact in close contact with the FPA on this matter. Thank you very much.
Dr. Paul, CMO. Dr. Paul?
Yes. So what they've found in terms of that's a great question. Thank you very much. What they've found in terms of pre-symptomatic, it's not that they're pre-symptomatic. It's just we presumed that it's mainly respiratory. So there is a lot of silent spread, and so therefore that is accurate. But it's not accurate because we know what we think we know. It's just that if I have respiratory symptoms, you'll be sure that it's spreading via there. But I might present, as we said before, is where the receptors are. So I may have something else. I may have loss of smell, loss of taste. I might have a headache. I might have other things affected me, and I will still be COVID positive, but I would not know. So therefore, the silent spread is just because all I'm presuming is respiratory. It might be where I'm having other symptoms that I might know it's COVID, and therefore I'll go out there and spread the virus not knowing I'm positive. So if I have overt respiratory symptoms, I will try to protect myself, maybe stay at home, be a little bit more cautious. If I don't, I'll just presume I'm not, and therefore that's a silent spread where we have other signs and symptoms, or it's just before we have it, and we just presume we have not, and that's why the wearing the mask is so important. So there is a fair amount of spread because we don't know who has it or who is, and remember we're shouting, as we said, shouting and singing, and so that's why the recommendation is for us to all wear masks. And so therefore, no matter who is having respiratory or non-respiratory, who is pre-symptomatic or who's symptomatic, at least it will reduce their spread to the other individual. Thank you.
Thank you very much. Newsday.
Good morning, Narissa Fraser from the Newsday here.
Good morning.
So to the CMO, a lot of people yesterday were calling for relaxation of the public health measures, specifically for election-related events or gatherings. Even the Commissioner of Police was one of those people. Knowing how campaigning ramps up when the election date nears, when it's closer to the election, do you feel like this relaxation would eventually have to be something that you consider? And to Minister Diyal Singh, on the groups of 25, is it that they can have as many groups of 25 as they please once they're separated in that regard? Thanks.
So Diyal Singh,
Yeah,
two questions sound like yours.
That is a good question. First of all, let me just go back to Mr. Cummins' question. I just got a WhatsApp from Dr. Sirji Singh, and he said, yes, there are regular updates between himself and the FPA. So that answers that. Right, coming back to multiple groups of 25. Look, a lot of common sense has to be employed in this thing. I will give you my own personal example yesterday. When we were going to nomination, we had 3 groups of 25. What did we do? We assigned a marshal for each group of 25. There were only three groups. We insisted people wear masks. So all I can say is that you can't have 100 groups of 25. That will eventually morph into a melee. But it is incumbent upon all of us to manage this situation. There is no regulation to say you could only have 3 groups of 25 or 1,000 groups of 25. A lot of common sense has to be applied, and it is borne out by what we said about children. At Wednesday's press conference, we spoke about children and the fact that you can't legislate for everything. And there was some criticism about those statements. But look, 3 days later, it is borne out by what Dr. Paul is saying. Before we jump on any particular bandwagon, we all have a collective duty to apply common sense in this environment, whether it's a political environment, the environment for children. So let us all be in this together and apply common sense. Don't have 100 groups of 25. Have a crowd that your campaign can manage effectively so that we don't encourage or have community spread. That's what I can say on the matter. I don't know the CMO wants to add anything to that.
There was another question.
Which one?
In terms of the 25, number 25.
About
increasing the number to 25?
No, beyond 25.
no, it
Beyond
was up
25?
here,
Yeah.
yes.
At this point in time, there is no discussion to increase the crowd, to increase the groupings to 25. If and when that decision is taken, like we announced with the bars this morning, it will be announced. But at this point in time, there is no discussion to increase the groupings to more than 25.
We move to CLC.
Hi, good morning, everybody. Are you
Good
hearing
morning.
me? Yes, I just wanted a clarification on one thing. Will the players coming for CPL be confined in their rooms, or would they be allowed to move around the hotel? And then secondly, just to fine tune what you said just now concerning the groups, they just allowed 25 persons in the hall when it comes to political meetings. Or is it at groups of 25?
So we will proceed to answer the first question in the meantime.
So with regards to the first question, so we would have had continuous communication, meaning the Ministry of Health as part of one of the stakeholder groups prior to going to Cabinet with a note regarding CPL. So the lead agency is the Ministry of Sport and remains so. We have a local organizing committee, which is chaired by Sport TT, I believe. So they are taking the lead. I don't want to jump ahead and say what are the we have a document that speaks to quarantine. And the quarantine measures are very rigid from the Ministry of Health perspective in the way that is done. Quarantine will even take place before coming to Trinidad with testing, etc. So the quarantine measures are very similar to what is being applied to the nationals of Trinidad and Tobago as they return. So it will be very similar, but I think the body is both the CPL and Sport, Ministry of Sport will be the appropriate bodies to actually go into detail if and when that time comes.
But it must be reiterated for the comfort of the population. The CPL contingent, 250 of them, I believe.
Just over 230.
Just over 230 will not be allowed to mix with the general public. They will be isolated and quarantined in one physical location, that is the Hilton. So there is no chance of contact with the other 1.4 million persons in Trinidad and Tobago. We are using this. We are using similar protocols as to what is happening right now with the West Indies team in England. Okay?
Okay,
Thank you very much.
Thank you. I'll try to go back to CLC to see if we can hear a second question at this time.
Okay, so my second question is just to get clarification concerning these 25 people. When it comes to political meetings, are 25 people allowed in the room, or is it that it's groups of 25?
You have to send that question. I go to Guardian Media Limited.
Good morning, ministers and doctors. My first question, Crystal Wilson would have touched on it in terms of the numbers for the election campaigning, because we would have seen that happen yesterday, and I know Minister would have responded. So therefore, my next question now to CM would be, can you tell us that last case that you mentioned earlier, that 137, that where would that case have come from, please?
Did you get the first question, really?
Yeah, so
right.
I mean, in terms of the case, we just got word of the case a few minutes ago, as you know. I believe the person would have come from the US, but we will get further details and that will be put out in our 6 p.m. release this afternoon. So I just got information of the person's name, etc., which is the normal from the Caribbean Public Health Agency that would have been sent directly to my director in Cora, as well as my principal medical officer of epidemiology, to ensure that the transfers occur in a timely manner. So that has been put in place, but at 6 o'clock we will put a little more detail as much as we could, maintaining patient confidentiality into the public domain.
Thank you. AZP News.
Good morning, ministers, doctors. Pamela Ramcharan from AZP News.
Morning.
Good morning.
I just have a question today, and Minister Dialsing, you can try to answer, is with regards to the cases that were confirmed of the persons that were repatriated with regards to Grenada. Now, I know that Barbados recently started opening their border and they put methods in place, certain protocols in place for persons that were coming in to in the country. So, were there protocols put in place for those that were coming in?
You've been breaking up through the entire question. We need to check your connection. You've been breaking up. I only got snippets, and I don't want to answer incorrectly. So if you could WhatsApp or text your question, please.
All right, we would go back to 98.1. One question. .1.
Good morning again.
Morning,
thank
Stephen.
you for the opportunity once more. This question can be posed to either Dr. Parasram or Dr. Paul. We have in regard to the natural tendency of us to touch our faces. I see it all the time, and apart from just washing, can someone ask, can hand sanitizers be used as an effective facial protectant in treating and in avoiding this thing of us being infected, as it were?
Okay, so we're talking about applying it to your face, right, Mr. Cummings?
Yes.
Okay, so we wouldn't advise that. One, it contains greater than 60-70% alcohol, so it will be, if it gets into your eyes, etc., of course, it will cause some damage and irritation. Having clean hands is the most important thing. So you have clean hands, you can't touch your face, of course, but your hands have to be clean, whether it's through washing or washing plus sanitization or sanitization alone. Of course, we make once your hands are dirty, meaning that you have actual soiling with some sort of entity, for instance, dirt or something else, or foodstuffs, it has to be washed with soap and water first before you sanitize to get the appropriate effect. So remembering that what we're trying to avoid is getting particles or viral particles from your hands directly into your nose, into your conjunctiva, which will be in your eye, or into your mouth. All right, so that's the basic premise of it.
Okay, thank you. We go back to Newsday. One question, please.
Hi, my other question is to Minister Diyal Singh.
Sure.
I know that you usually vet a lot for wearing masks, but especially when people are conversing. But back to the campaigning and tying it in with that, is it that when people are speaking with the media, you think it's acceptable then to take off the mask? Because we've seen a number of candidates, when they are being interviewed, that's when they take off the mask.
Yeah, so it's a difficult one. I did it yesterday. I take off my mask when I'm here. What we tend to do, or what I tend to do, when I'm being interviewed face to face, I try to step back as much as possible, and I don't speak loudly. The softer you speak, the less chance of droplets being carried. So again, a lot of common sense has to be applied when speaking to members of the media. It's incumbent upon both interviewer and interviewee to maintain some distance. What I do sometimes, you will see me, I wear a face shield. So sometimes I wear a face shield which protects both myself and the person I'm speaking to. Face shields, the transparent face shields, are easily available. So I would suggest to all candidates, I use them on my walkabouts. I don't use a mask on my walkabouts. I use a face shield. That protects both the constituent I'm speaking to, and it protects me from them. So there are a lot of common sense, simple measures that we could apply across the board.
Thank you very much. I have a question to the CMO. There's a private hospital in Port of Spain that's requiring all patients to take a COVID-19 test, no matter what procedure they have to do, and they are charging $1,600 per test. Is the CMO or minister aware of this, and can they comment on this?
Okay, so yes, I am aware of it. Under the policy from the Ministry of Health as it stands for the public sector, basically we don't require anyone to have a test prior to elective surgery, prior to coming in for antenatal clinic checkup or delivery. I got information that certain private hospitals are asking for a COVID-19 test prior to any procedure being done, elective or otherwise. So our policy stance from the public health perspective at the ministry is that it is not necessary at this time based on the epidemiology of the epidemic in Trinidad and Tobago. We are still listed by WHO as sporadic cases. We haven't had, as I said before, a local case for more than 80 days now. So what we advise is that you do an enhanced pre-operation surveillance. So our screening is enhanced, meaning that if you want to do chest x-rays maybe to look for something, or you want to ask probing questions in terms of viral history, etc., that is advised, and that's what we are doing in the public sector. Of course, if you have an elective procedure and you have a viral illness at the time, that is postponed until a future date, and testing can occur if you have symptoms, but the policy from the ministry side is that it is not necessary at this time.
Okay, thank you. We want to go back to Guardian Media Limited.
Minister, no, I didn't have any other questions at this time. I just was again interested in how we're going to be containing the numbers during the election campaigning on the road. I know that we've spoken about numbers of 25 in terms of keep wearing masks, social distancing, but of course what is left if these persons do not adhere to these protocols? What do we do at that point?
Well, that is where the Trinidad and Tobago Police Service will come in.
Okay, I think there's a question from ACP.
Right, yes.
In addition to nationals being tested on arrival to Trinidad and Tobago on a repatriation flight, were protocols put in place in the country from where they were coming in, similar to protocols put in place by Barbados as they started reopening their borders?
Okay, so in terms of, I'm not 100% sure in terms of what Barbados has put in place prior to coming. I heard from discussion at my CMOs with my CMOs is that they would have been doing some form of testing prior to being allowed to actually board the planes. So I think that's what is happening in certain jurisdictions. We are choosing to have our test done, our first test done on day 1 or day 2 of arrival into Trinidad. We go into a rigid quarantine, and then we actually have a test done on day 13 or day 14 prior to release from the quarantine. So that has been our procedure from the start, and I think it has worked very well in terms of ensuring that no one that is positive comes out into the population. Having a test done prior to departing and getting a test done a day later makes no difference once you're in quarantine. If you're coming into an open border, we're dealing with a different scenario. And of course, when we get to that stage, we have procedures in Trinidad and Tobago that we will put in place, that we are finalizing right now when that time comes. But again, it is a country to country variance that we are seeing, and they have to make decisions based on what they think is the best fit for their country. In terms of doing a test before you come on a plane, having a point PCR test, which is a DNA RNA test, tells you very little. At that point, it can tell you what happens maybe a few days before. It may pick up to 10 days prior if you had any signs and symptoms. But you can be negative, as we have seen happen in many cases. And then you're actually within the incubation period. And then a few days later, we get a positive. We have seen many of our cases at day 12 and day 13 of our quarantine. When they had a negative test upon arrival, they now have a positive test 12 to 13 days later. So we think the way we are doing it in having a test, we don't want to waste resources as well. Having a test done on day 1 or day 2 on arrival, and then on 13 or 14, is a good way of ensuring that the quarantine period is adhered to, and that we know what is going on prior to discharge into the population.
CMO, if I could follow up with a question, because that question asked is a very, very important one. Countries that insist that before you come into their country, you must be tested. Do you know what type of test you're doing, whether it's a PCR, a rapid test, an antibody test, and so on? And what reliance do you place on those tests?
So there are 2 types of tests that you can do. They can ask for a PCR test, which is actually the gold standard for testing if you actually have active disease. So it will give you from day 0 of onset of symptoms to day 10, it will give you a reliable result. So that will actually test for particles, RNA left in your system. The other tests that people are using are a rapid test, what we call a rapid test, which is serology. It tests for antibodies, meaning that for antibodies to occur with this particular virus, we have been told that this will show up 10 10 days and onwards, usually 10 days to a month after you actually have a positive infection. So an antibody picks up a little bit differently. It will pick up someone that has an infection that is 10 days or older, and with the reliability of the test, the antibodies tests tend to be much less reliable than the PCR testing. So that is another factor. There's a lot of false negatives and false positives. There are some tests that are better than others, but generally speaking in the world so far, as it relates to COVID-19, the antibody tests are not as specific and sensitive as we would like it to be at this point.
Thank you. I just want to ask the second question for AZP News.
Yeah.
Are there any concerns about the resumption of classes on Monday for SCA students? Will public health officers, safety officers be assisting or on hand to enforce or monitor adherence to guidelines, or does that fall on the principals and teachers? I think this for the CMO.
Okay.
Yeah, so we have also sent our final guideline as I promised. I think we promised on Wednesday. We actually got it to them physically on Thursday. So you would have noted there was an interim guideline put out by the Ministry of Education to speak to, because SCA, those students would have had to restart classes on the 20th. I did submit on Tuesday to the Ministry of Education our Ministry of Health guidelines. The Public Health Inspectorate have gone out to some schools to ensure that they have connection and communication with the principals to ensure that they are aware of the public health guidelines, and if they have technical questions, they can assist. But outside of that, the Ministry of Education will be asked to monitor through the principals, through the school supervisors, the guidelines, the implementation of those guidelines.
Thank you. We go back to CLC. Let's hope we can hear you for your final question.
Are you hearing me?
Yes.
Yes, we are.
Okay. So concerning the extra case which Dr. Parashram pointed to earlier, is that coming from the group that came from Canada or the group that came from Grenada?
No.
Then secondly, Dr. Rowley pointed to some legal matters which Dr. Parashram encountered as a result of the case. Are you hearing me?
Nadine, I think we got your first question before. We want to answer this one, please.
Yeah, so with regards to, I believe that person came not from the Canadian or Grenadian group. I think that's a person that came from the US. But as I said before, we will send a little more information out on the 6 p.m. update.
Okay, Minister Diyal Singh, there's a question for you. The person would like to get a breakdown of the cost of state-supervised quarantine.
Oh, okay. So state-supervised quarantine. We ran some figures. So there are two types of state quarantine facilities. One, some that we rented, like Balandra, place in Sangre Grande, and some that we actually outfitted and sort of built from the ground up ourselves. The Pinal Debe campus and the Tacarigua facility cost about $1 million to set up. There was a structure, but we had to put in partitions, beds, and so on, bathrooms, and so on. UWI would have to have spent a couple extra $100,000 to ring fence and do other external works in Debe. So those were the setup costs for those two facilities. We rented Balandra at a cost of, I believe, $80,000 or $90,000 a month. We didn't have to do much infrastructural works there. We would have rented the facility Brooklyn in Sangre Grande. We have an agreement with Home of Football with Southwest. At the end of the day, those were some fixed costs. We also calculated now the variable cost. That is, what would it cost the state to quarantine a person? We worked out it costs about $100 per day to quarantine each person in a state facility, and then in the hotels it costs about $150 per day. So I'm giving you some idea of the fixed costs and some idea of the variable costs. It's a very expensive process, and I think the taxpayer needs to be thanked, because this is being borne by the state and directly by the taxpayer. So those are some idea of the costs that we incur.
Thank you very much. We've come to the end of today's virtual media conference, and do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. Trinidad and Tobago, I would like to appeal to you to remain vigilant and follow the public health guidelines because COVID-19 remains a real threat. We know that 3 returning nationals from a group which recently came back from Grenada tested positive for COVID-19. All established protocols are being implemented, but it is a reminder that COVID-19 is still at our doorsteps, and that is why we want to appeal to anyone having social gatherings, patrons of bars and bar owners around the country, not to become complacent, but to follow public health guidelines. Bars will now revert to a closing time of 10 p.m. from July the 20th. And all we ask is that you observe the basic protocols set out by our public health officials. Please be responsible. We understand that it's easy to forget these guidelines when everyone is having a good time, but the guidelines provide a measure of protection in the midst of this pandemic. Even as we embrace our new normal and enjoy the things we could not do a few months ago because of COVID-19 restrictions, we must wear our masks. Masks protect others around you and prevent the spread of COVID-19. It is important that we do not wear them under our nose or remove them to speak where there are persons within 6 feet of us. We must not only wear our masks, but we must wear them safely. I wish to remind you, no mask, no service. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to keep the curve flat and beat COVID-19. Stay safe, save lives. May God bless Trinidad and Tobago.
This is TTT. Live for local.
Hi, and welcome again to the eLearn program brought to you by the Division of Education, Innovation and Energy. My name is Mr. Thomas, and I will be teaching you organic chemistry. So, last day, we would have looked at naming compounds. So let's take a little recap on what we would have done. 1, we would have learned about naming organic compounds. All right, in that we would have learned that we would need the organic prefix. That would be meth, et, prop, bute, pent, hex, as it goes on and on, in order for us to name organic compounds. We would have looked at types of formulas. So we would have looked at the molecular formula. We would have looked at the condensed formula. We would have looked at the structural formula. We would have even introduced what we call the skeleton or the line structure as well.